Great. So good morning, everyone, and welcome to the first of MPHA's 2016-2017 webinar series. My name is Becca Bolas, for those of you that don't know me, and I am the Executive Director of the Maine Public Health Association. And I just want to start off with some brief introductions and a little bit of an orientation to our webinar series. First, I just want to say that we're very grateful to the Maine CDC for kicking off this year's webinar series, and are especially also grateful to the Maine Area Health Education Center and the New England Public Health Training Institute for their very generous support of this educational opportunity, which is available to anyone in Maine who's interested in public health. The goal of our webinar series is to feature and promote ongoing public health work in Maine, and that includes accomplishments like the public health accreditation that you're going to hear about today, as well as different current events, programs, and resources that are available to public health professionals across the state. There is a lot of exciting public health work in Maine, and we want to celebrate and promote the work that you do. So if you are interested in being featured in one of our other webinars, please let us know. Our plan is to have one every month. So shortly, I will turn over the presentation to Sheryl Peavey and Nancy Birkhimer from the Maine CDC, and today they'll be sharing about their experience achieving accreditation and their plans for the future. If you have questions while they're presenting or once they're done, in the interest of time, I'm going to ask you to please send me your questions. And the way to do that is to use the chat feature. And so there should be a gray bar with a gray bar on your screen, and there is a chat bubble. And if you click on that bubble, a drop-down list of different meeting attendees' names should be there. Just choose mine and send me the questions, and then at the end of their presentation, I will facilitate some Q&A. And the reason really to do that is just to not have it be distracting. If you send the questions to the whole group, it'll kind of slow down the presentation. So again, I just want to thank you all very much for being here. I'm really excited to be kicking off our webinar series with this presentation. And so now I would like to turn it over to Sheryl and Nancy.
Good morning, everyone. I'm Sheryl Peavey, and I'm delighted to be here with Nancy Birkhimer. We are excited to talk about public health accreditation. Of course, you may know that Maine is just one of a handful of states that has achieved public health accreditation at the state level. That was the result of a lot of work internally here at the CDC, but also because of the partnerships that we have across the state, including many of you who are listening right now. So thank you for joining us. I'm glad to share our story with you. What we're going to talk about today really is the steps in the process that we went through as a state agency to go through accreditation, to talk about what some of the challenges and our next steps are going to be, and I think most importantly, show you how the domains of accreditation are reflected in our strategic work plan currently as we move forward. Nancy.
Okay, so our accreditation process has been, our journey has been long. These are some of the early steps that we took prior to any formal interaction with FAB. One of the keys that we believe to our success in being accredited in our first round was a lot of preparation. We knew that there were specific timelines in our formal application process, and we wanted to be sure that we had all of our ducks in a row so that we could meet those deadlines. Another key to our success was having an accreditation coordinator. Joe Manzo led us through some initial steps, and then Kate Marone joined us in January of 2013. And she provided really tons of expertise, coordination, encouragement, cajoling, and really kept us on track throughout the process. So a little bit about accreditation. The accreditation process for public health is based on 12 domains. 10 of those domains are essentially the essential public health services, and then there are 2 additional ones. So the first domain or first essential public health services has to do with monitoring of health status. It's both the long-term monitoring as well as the collection, analysis, and use of public health data. Number 2 focuses on diagnosing and investigating health problems, and that's primarily around our infectious disease and environmental health hazards, but also includes laboratory services and 24/7 communication. Number 3 is health education and promotion and the provision of health information to the public, including multiple needs for various audiences and culturally competent communications. 4 is working with our partners at the community level and making sure that we are supporting community level efforts. Then 5 includes our state health improvement plan. It also includes our emergency preparedness plan and an internal strategic plan. And then there's a number of public health policies that one also asks us to look at. The 6th domain is about enforcing laws and regulations, and for us this is primarily in the area of environmental health, our lead program, drinking water, health inspections, etc. Moving on to 7 is promoting strategies to improve health access to health care. So this is how we monitor accessibility of health care and how we can help improve access. It is not about the provision of direct services, but really more on how we facilitate access to those services. 8 is about a competent workforce, and it's both looking at the workforce throughout the state, but also internally at Maine CDC and what are the professional development work that we do. 9 is focused primarily on quality improvement and performance management. So how do we measure how well we're doing and what do we do to improve that? 10 includes both looking at what research we might be engaged in and making sure that we're using good research principles as well as evaluation principles, and on how we use the research that is already out there, the evidence base for public health. And then the last 2 are not part of the 10 essential public health services, but they are important in terms of maintaining administrative and management capacity, so things like our general policies and financial management. And then the last one is engaging our governing entity. And so for some states have a state board of health, Maine does not. So our governing entity is actually the commissioner of Maine DHHS. And so this domain talks about how do we communicate public health and have conversations with our commissioner around our mission and our work. So this is just a snapshot of one of the many standards and guidance that we get from FAB. And so for each standard, there are a number of measures. Each measure, they give us the purpose and significance. And then they have a list of required documentation and guidance as to what that documentation should include. So you can see that it can get very detailed. There are 105 measures that we needed to look at, and then within those, as you can see in this example, there are often a number of required documents. So once we got through our initial stages of learning and planning in December of 2013, we decided we were ready to take the plunge, and we submitted our letter of intent. That set a 6-month period in which we had to make sure that we were ready to submit our application. The application required us to provide a strategic plan, our state health improvement plan, and our state health assessment in May of 2014. Then we had a year in which we were given to gather our documentation. It was actually a year plus, because there's a turnaround time in terms of the initial application being reviewed by FAB. So in June of 2015, after a lot of documentation gathering and review, we were ready to submit our documentation. Then FAB reviewed that, gave us some questions, and sent it on to the site visitor, and we had started preparing for our site visit at that point. So this is a snapshot of how we measured progress towards those 105 measures, and you can see how they're sort of spread out, and we started with everything being red and proceeded to the yellow, green, and blue. So as we gathered documents, we had those go to our senior staff that looked at it, and then the commissioner's office reviewed it, and then the descriptions of the documents were created. And so the final step was to upload it into the electronic system via eFab, which is their FAB system. So slowly we got through figuring out what those documents were, had the internal review, had the commissioner's office review them, and uploading them in there. So you can see our progress was moving forward until we had them all done. So once those measures were done, they were reviewed, and the site visitors were looking at them, we started preparing for the site visit on our end. We had from sometime in August until March, where we were doing that preparation. We identified who would be part of that, who could best represent each of the domains and speak to the documentation. Our coordinator looked at what the typical and possible questions were, what the guidance for do's and don'ts were. The big thing was to, be sure that you were not being too defensive, and I think we did that fairly well because it's very challenging to, have somebody question your documentation. We reviewed the guidance again. We reviewed our documentation. We held a number of practice sessions so that we felt that we were ready to respond to questions that they might have.
So I'm going to jump right in, Nancy. There's a couple of important points about the preparation for the site visit. The site visit itself included representatives from our partners in the community. It was not just a discussion or a conversation with Maine CDC staff. So we also had to feel very confident in how the perception of the Maine CDC was going to be portrayed as well. The preparation itself internally, meeting with each other and going through practice questions, really was another opportunity for us to reinforce the understanding among our own team members about the scope and capacity that we have within the Maine CDC, and also to share, again, best practices on what we're doing with our partners in the community.
So the site visit occurred in March. It was 2.5 days. The site visitors in their exit interview gave us some immediate feedback that was part of the site visit report when we received it a month later. That was a detailed review of each of the measures and how well we met them. And then they gave that site visit review to the board. The site visitors did not recommend any status for accreditation. They simply write their report and send it to the FAB, and FAB makes the decision. And so we were notified in May that indeed we had received accreditation. So the site visit report results. This was exciting. We had, there are 4 levels of measure in terms of how it would measure. We had no measures that were not demonstrated. And we, you can see here the split of fully, largely, and slightly demonstrated measures. All of our domains were more than 50% fully demonstrated, and domain 4, Mobilized Community Partnerships, was fully demonstrated for all measures. And I think that this had a lot to do with the high level of support that we got from those who participated in our site visit from all of the outside folks.
I think it also had to do with the preparation and the decision well in advance to engage partners in deciding whether or not we wanted to pursue accreditation and making sure that it reflected what the priorities were as a state as a whole.
Our slightly demonstrated measures had a lot to do with timing. We had some we had one question around diagnosing, investigating environmental health investigations. We are already looking at different examples that we could have used in that, but chose not to for various reasons. And then the other three measures, slightly demonstrated measures, were in our policies and plans. And our strategic plan, our SHIP, and our emergency operations plan had only been finalized within the year before accreditation. And so we did not have reports on progress or updates that we could show. All of these are in the process of being updated, worked on, and reports, for example, for the SHIP have been finished and are now available on our website. So the site visitors gave us their three greatest strengths, and these again focused on those community partnerships and on quality improvement. Again, these strengths are really some of the things that we will be continuing to work on as we move forward, knowing that they were important aspects for accreditation and, you know, really led to some of the other areas of success as well. Our greatest opportunities for improvement, you know, some of these seem to be just continue to do more of what you're doing, which was really nice for us to see. You know, looking at quality improvement, documentation, and our updates and reviewing of the All Hazards Emergency Operations Plan. So now that we're accredited, we need to maintain that accreditation. It's a little less intense, but still requires some ongoing work. And so there are two stages for the annual report. We are accredited for 5 years, but to maintain that is this annual report requirement. So section 1 of the report includes some progress on those areas that were slightly demonstrated. It also includes a need to identify any major changes in structure that could impact accreditation. So we've gone through some reorganization that included merging with the Division of Licensing and Regulatory Services. So Maine CDC and DLRS are now one entity. That will not affect our accreditation in any way. There are some areas that are outside of the scope of FAB, but that doesn't necessarily mean that they would look at our status in any different way that we would anticipate. We also will be providing updates in Part 2 to our major documents, and then providing an update on performance management and quality improvement. We are required to provide an example of a quality improvement project, and then describe some of our efforts on some emerging issues that they have identified.
So among those emerging issues, I would like to highlight the public health and healthcare integration, in part because that is a focus and a component of the State Innovation Model grant, the STEM grant that some of you may have heard about or have been participating in as part of a work group or steering committee member. That integration for healthcare transformation really called for state agencies to pull together population health and the strategies that are being implemented by the health insurance arms of the state Medicaid agencies. And that, to me, is a very exciting component that we can really highlight as something that we've invested a lot of energy into. We've applied for and received funding around climate change. We are working diligently on emergency preparedness. And I think what is exciting is that each of these emerging issues is being reflected in work that we're that the Maine CDC is doing now, currently.
So our next steps is we still need a new accreditation coordinator. We had a contract for our accreditation coordinator that ended in June, and we've been working on recruiting a state position to maintain this. So that position will work on both accreditation and workforce development. It was posted about 3 or 4 weeks ago. It will be reposted shortly so that we have a good pool of candidates. And if you know someone or you yourself are interested in applying for this position, we really encourage you to check it out. I think it gives somebody an opportunity to have a really broad view of public health in Maine CDC and you know, make some an impact in a lot of different areas. We also have reformed our agency-wide coordinating committee and our domain teams, and we are now engaging in a domain-by-domain review of the site visit report. We're identifying opportunities and improvements, any updates we need to do based on a new version of the standards, and making sure that we have all of the information that we need for our annual report.
Of course, a component about maintaining accreditation is also sharing our experience, which is one of the reasons that we're excited to be talking about it today.
So reaccreditation will come for us in 2021. We don't know what that process is exactly. There's draft standards and measures that FAB has posted for comment, and they are due to release their final version in January of 2017. We do know it will be an abbreviated process, and that we will need to make sure that we meet the latest version of the standards and measures, and that's currently 1.5, but in 2021 it might be 2.0 or 2.5, so we'll see. But we'll keep that in mind as we move forward.
So I think one of the most powerful pieces about accreditation is the intersect between the focus nationally on standards that we want every state health agency or health department or local health department to exhibit, but how those standards are reflected in the Maine CDC key strategies and our work plan, I think is very important. And we want to be able to share where we are at the moment as part of that discussion. So if you reflect back on the points that Nancy brought up earlier around the essential public health essential services, you'll see that in our goals and priorities, at least 3 of them are reflected. And you'll see again, using public health data to inform and educate, to mobilize our community partnerships. One of the areas of strength that we had, we want it to maintain, still be an area of strength. Enforcing laws and regulations that protect health, and then demonstrating effective and efficient use of resources, which does get back to some of the other parts of the accreditation domains, particularly around having a capacity and strong financial oversight, and also engaging the governing body in what we're doing. So these components really are what we reflect now in our work plan moving forward. And we can talk about them in a little bit more detail. Go ahead, Nancy. Oh, sorry. So in that first one of using data to inform and educate, among our priorities for this current state fiscal year, or at least the next 12 months, enhancing our communication, the Maine CDC communication and data sharing pathways with the Office of Maine Care Services. This does get back to the emerging issue, but also reflecting how are we able to integrate the state innovation model principles of healthcare transformation in the work that the Maine CDC is doing, and how might it be more broadly communicated across the agency, particularly because there are populations that focused on, and also what Maine Care is doing as well. We share the same goal of having a healthy population. We also want to have the Maine CDC, in part of its informing and educating, use technology to share information rather than having some and some of you may recall some of the progress reports for the SHIP. We'd like to be able to have that in a more timely way posted online. So that's going to be one of the things that we're working on this year. And again, getting back to healthcare transformation, instituting public reporting, being able to have information up so that all of you can see where our health status is at a given point as information and data is updated would be a far more timely way for you to also be more responsive locally and us more responsive at the state level to the changes and shifts in our population health status. Our second goal for this upcoming year is really around mobilizing our partnerships, and that is reflected in the new model of the public health infrastructure, making sure that we have the investment put out to all of the district coordinating councils, that we have the tools in place to be able to assure success at the local level, which will ensure success and positive improvements and outcomes at the state level. We're also focused on creating a statewide maternal and child health network, making sure that we have the capacity across the state in much the same way that we are looking at the new contracts that focus on tobacco and substance abuse and engaging youth at a statewide level. Obviously, maintaining and improving our accreditation status. We have a couple of areas that we acknowledge can be areas for improvement, but making sure that that stays on the radar for all of the Maine CDC staff and team members. One of the other partnerships that I'm also excited to talk about is developing stronger work pathways with the Office of Child and Family Services. As it has been discussed in the past, child abuse and neglect is a public health issue, and I think that it gets reflected in what we're doing, but being able to call attention to that relationship within the department itself as an important partnership really does need to be at the forefront of our thinking. Enforcing laws seems like a pretty straightforward kind of thing, but there's ways that we want to be able to do our work more efficiently and effectively, and making sure and tracking the data about how prompt we are in doing our investigations, whether these are outbreak investigations or immediate jeopardy investigations related to hospitals and long-term care facilities, among others. Strengthening the medical marijuana program, regardless of how the vote may end up tallying, is still an important component. We have the responsibility to make sure that we are following the statute and the rules as they are being implemented to make sure that from a public health perspective, we have the appropriate oversight and sharing of information as far as medical marijuana goes. Employing streamlined inspection processes really does get to our hope to cross-train now that we are a little bit bigger with the inclusion in CDC, and looking to the opportunity and minimize the number of times that we have to visit a particular business or operation. Being effective and efficient is a department objective. It is a priority. Making sure that we're able to operations. So look, are developing and implementing a cost allocation plan so that we are better able to direct out to the community those direct service opportunities to the greatest extent possible. One of the ways for us to be able to do that internally is to look at how long it takes for invoices to be processed and making sure that we know at a given point in time how much money that we have and are able to work with. Making sure that we're available to everybody, so having core business work hours, particularly across the broad range of services that we offer. looking at Fortis as a document archiving mechanism and tool so that we're able to reduce the amount of paper that we have and allow for more efficient and timely response. We also want to make sure that we're focusing our programs and services. And one of the things that became quite apparent to me as I came over to this building was the amount of brain power that we have in the Maine CDC, not just in Water Street, but also in the various district offices and local offices here in Augusta. Being able to pull together all of the epidemiological supports that we have, covering whether it's population health or environmental and community health or infectious disease, and coordinating that as part of what we're doing with the Office of Maine Care Services and other parts of the department are key. And then again, as we've talked about, developing a formal cross-training within the CDC itself.
Okay, thank you. So there you go. That's our accreditation journey and where we're going next. I know that we have a couple of questions that have come in through chat, but Becca, do you want to facilitate this portion?
Yeah. So again, if you have, so thank you for that very comprehensive presentation. There was a lot of really helpful information in there. I just want to remind everybody who is listening in that there is a chat bubble on the gray bar, and if you click on that and where it says all attendees, if you choose my name from there, you can send me your questions. So I do have one question that came in, and that is, which community partners were included in the site visit?
So I do not have the list in front of me, and I don't think Sheryl knows it off the top of her head, but I can give you a general idea of who we reached out to. We had a very long list of potential partners, as you will all know, and needed to make sure that they all fit into the room and wouldn't spend all of the time just doing introductions, but would really have a chance to interact with our site visitors. We had representatives from the major health systems. We had representatives from the district coordinating councils and the FCC. We had the state coordinating council for public health. We also had, I believe, universities represented in the room, and Lori, fill in anything if you want to. I'm trying to think of some of those other folks. Portland Public Health, as well as Bangor, I believe, were invited, and some of our medical care development, public health,
tribal health
partners. So again, we tried to cast the net broadly with the people who knew our work and could speak to our accreditation capabilities.
Thank you. The next question is, how will accreditation be impacted by some of the key staffing vacancies at the Maine CDC, including the program manager for the Partnership for a Tobacco-Free Maine and the program manager for the Comprehensive Care Control Program?
So I'd be happy to talk about the staff vacancies. I'm delighted to say that we are slowly working at making sure that we are at capacity in very key areas. And in fact, in the last month, we have 10 new additions to the Maine CDC, including the new lead inspectors and our new medical marijuana program manager. So we have a number of positions that are being filled. It is with an eye to making sure that we do not fall short on those accreditation standards as we're filling positions. I believe many of the positions have been posted. Two positions specifically.
Sheryl, it froze for a minute. Could you say that again, please? Sorry.
Oh, that
just like the last sentence. Just the last sentence.
I will follow up on those two positions that were asked very specifically. I don't know the status of them both offhand.
Okay. Thank you. And I do have just one more question, it looks like, and this is related to similar area, so prepared public health workforce. What is your plan for providing public health nurse services to the various vulnerable populations in Maine?
So your voice on this microphone, at least, is getting a little bit garbled. I'm going to try to repeat the question, then probably Sheryl's going to try.
Okay.
And outreach to vulnerable populations. Oh dear. Okay, our session is terminated unexpectedly.
So we just, and I only had one more question that came in, and now I need to see if I can pull it back up. It was, and I can't because I had to close out. So it was about a prepared workforce, and the question was around public health nurses serving vulnerable populations around the state. And I think it was when you started to answer that question that it froze. I'm so sorry about that. And then I think that will be the last question for today.
Okay, well, let's hope it doesn't freeze again.
Yeah, I know.
It's an important question to have been asked, and I'm actually glad to take the opportunity to answer it. The focus on vulnerable populations really is one that the department has put forth, making sure that what we're doing for work across the department really is prioritizing where our resources are. One of the key pieces about making sure that we've got a strong workforce across the state is making sure that we're not limiting ourselves to simply just state employees doing work. And if we think about public health nursing as a component of the work that is across a continuum of services, not necessarily handled just by public health nurses specifically, but also by community health nurses, as well as some of the home visitors and early Head Start teachers in classrooms that are doing the work of public health nursing, which is really making sure that we are observing and interacting with people where they are in their communities. Making sure that we have the right workforce out there, particularly around the vulnerable populations, has been a key priority area. And we've been in discussion in particular around infectious disease and making sure that we are addressing refugee health issues, as well as the tuberculosis, latent tuberculosis issues, and reprioritizing the time that we have for public health nurses to be spending with those populations. We had not in the past taken advantage of the resource that we have in the community health nursing community, and looking at how might we best be able to use that resource and expand that network across the state in a more thoughtful and organized manner to supplement that work so that we are able to reach populations. And additionally, as we had talked about earlier, the use of technology, particularly to address some of the travel times that we have, being able to have nurses not spend, our public health nurses not spend an entire day to do direct observed therapy with clients, but making sure that we have, as appropriate and as clinically and economically feasible, making sure that we have the opportunity to use the technology to minimize travel time, which would allow our nurses to be out in the community in a more efficient manner.
Thank you. I don't see any other questions coming in, so I think that is it for today, but I'm sure if you do have other questions, you can see here Sheryl and Nancy have provided their contact information, so I encourage you to reach out to them. And Nancy, if you don't mind advancing to the last slide.
I can get there. There we go.
So I just want to let everybody know. So first, I just want to thank you both again for taking the time this morning to talk with us. And I want to let everyone who's still on know that our next webinar is scheduled for Tuesday, December 6th at noon, and the Natural Resources Council of Maine will be presenting about climate change and health. The registration link is there, and I want to thank again Maine AHEC Network and the New England Public Health Training Center for their support of our webinar series. And thank you all very much for joining us today, and I hope to see you on a future webinar. Thank you.